Hi, everybody. This is Frankie Niwot, functional nutritionist, partner in crime, and I'm Dr. Maggie Yu, and I'm Functional MD to the rescue. Today, we are going to be talking about food intolerance, huge issue in autoimmune disease and part of the autoimmune hack. And for me, it's the most important thing to actually get tested in anybody with autoimmune disease or anyone with any chronic health symptoms anyway. And so if you're already currently watching, go ahead and give me, let me know where you're watching from. And give me a thumbs up, a wow face, heart would be awesome. If you're watching the replay, feel free, give me some kudos, thank you. So my name is Dr. Maggie Yu. I'm a functional medicine physician. I've been practicing for the past 20 years. The first 10 years of my career as a family practice physician, and the last 10 years of it as a functional medicine physician. And I pride myself, as far as what is functional medicine is, I pride myself as a functional medicine physician to ask different questions, provide different tools, and provide different outcomes for my patients. And I did that for myself and my own health when I went into early menopause at the age of 36 and diagnosed myself with having Hashimoto's. So we're here today, and we're going to dive in pretty quickly. We're doing 30 days of Facebook Live. And the reason we're doing this is to make functional medicine accessible to not just our patients. They're challenging me to make this accessible to all their friends and family and autoimmune disease groups. So if you're part of an autoimmune disease group, please share this video to that group. If you know somebody who can benefit from this discussion on food intolerance or on autoimmune disease, go ahead and post their name in the comment section underneath so they can watch this in the replay. It's through the sharing of this video that some of our videos have gotten 1,000 views just in the first day. So please share this. This is information that's available to everyone. So we're doing this for 30 days of Facebook Live. And go ahead, if you're watching live already right now, give me a thumbs up, wild face, tell me where you're from. Wonderful, thank you. And then go ahead and join our, like my page, get notifications. Okay. So today I'm going to dive right in because this is a big topic that a lot of you have been asking about, which is what the heck is food intolerance? And there's so much misconception out there about it. I want to dispel some of the myths. I could do probably 2 hours on food intolerance alone. But today what we're going to do is I'm going to first off say, why is food intolerance so important in autoimmune disease? On the last two videos, if you look over the last couple of days, my first two videos on the autoimmune disease hack was about why infection is really key. Identifying past sources of infection as a trigger for autoimmune disease, identifying current infection and treating them. I went over the tests that you need to do for an infectious workup in functional medicine in someone with autoimmune disease. Check those videos out, and if you benefit from it, share those, okay? Valuable data. None of your doctors are going to be telling you that. So these are the secrets to how to hack autoimmune disease. Yes, yesterday was about hormones in autoimmune disease and why hormones matter a lot. That video has gotten a ton of views. Thank you for sharing that. Today we're going to be talking about food intolerance. And what is the difference between food intolerance and food allergies is something Frankie and I actually talk with patients about a lot. I'm just going to have Frankie introduce herself and talk a little bit about what she does and what she brings to the table here to us today.
Yeah, thanks so much, Maggie, for letting me come on. Maggie and I work really closely together with all of our patients.
Partner in crime.
Yes, absolutely. And so with food intolerance, we're really looking at the things that are underlying. What are the root causes as far as the slow growing immune responses with food? So food intolerance is so key because oftentimes it's totally disregarded as far as, you know, you go to an allergy doctor, they take your blood, they put it against food, they say, oh, there wasn't an immediate reaction, so there's no problems. But what we see with using the food intolerance testing is that same blood, when it sits next to those foods for up to 10 days, the problems start. And what we work with is really looking at a methodical way of removing, replacing, replenishing the diet, which is where I come in a lot.
It's true. And I think it's funny, as a doctor, as an MD, practicing MD, one of the things I've noticed is that there's so much myths about food intolerance. So a lot of people tell me, oh, the tests are bunk. Okay, so yes, many of these tests are bunk. That is true. So I'm not saying that. So there's many tests for hormones that are bunk. There's many tests for food intolerance that are bunk. That doesn't mean food intolerance is bunk. And what I'm going to say is that food intolerance is basically what Frankie was talking about. Is a lot of people think about food allergies in terms of immediate allergic response, and those activate what's called IgE antibodies in your body. That's an immediate big allergic response. So if you know somebody or you yourself have, eaten peanut or like shellfish and you instantly get the throat, tongue swelling, that is an IgE emergency room, immediate, extra big response. That's an immediate allergy, and that's what people go see an allergist to do to figure out. But honestly, most of the time, by the time someone's 30 or even in the late teens, you already know what those things are. And that's not what we're talking about. That is food allergies. Food intolerance is totally different because food intolerance is still an allergic response. But what it is involves antibodies called IgG antibodies, which are slow and low. So it takes IgG antibodies, I think of them as growing response. It takes 3 hours to 3 days for some of these symptoms to show up. Now, what if it was more than one thing? The thing is, what if it's broccoli and it's sesame seed? Okay, and maybe broccoli itself isn't causing the reaction. Like it's only like I to look at it on a point scale. And we talk about that a lot.
Yep.
So if your allergic response, your slow allergic response, takes about anywhere from 0 to 10 is a score, and you only feel symptoms from 5 points or above. And let's say broccoli's. Thank you for the hearts. If broccoli is like a 3 points and sesame seed is a 3 point, it's possible that in that week, if you consume broccoli and sesame seed, you'll notice a response. But if you only ate broccoli, you don't get a response. Does that mean the test for broccoli is bunk, the result's bunk? No. It means that it's complicated. There are additive effects of multiple food intolerances, and that's why an eating map makes a difference.
Absolutely.
One of our videos on the infection, we talked about testing, and one of the things that we talked about is, and Frankie is the food intolerance extraordinary reviewing these with our patients. And if you look at this test right now, and Frankie can go a little bit over some of the basics of what this test results kind of mean. Some of these, it's literally a food map.
Yeah, and so what we use here is it breaks it down into all of the different categories. So we're able to look at not just dairy as like a whole group, but we're looking at the actual proteins in the dairy. We're looking at the different proteins that are options as far as animal proteins. We're looking at eggs. And eggs is a really interesting one that we're going to go into a little bit more when we share some stories about some things that we found through food intolerance with our patients. But it also looks at all of our fruits. It looks at all of our sea creatures, our river creatures, as far as our fish, crustaceans, shellfish. And there's a tricky section down here at the bottom that looks at our miscellaneous. So part of that is it can look at yeast overgrowth in the system. And this is something that Maggie and I see a lot in our practice, is that people are coming to us, they have underlying food intolerance going on, but they've been constantly exposing themselves to these food intolerances for years and years and years. This creates an environment where the infection can grow, where things like candida can grow, where other infections can take up shop in the gut.
And the cool thing is, if you look at this, this is a road map. I love the fact that this is a road map, because if you look, this whole section is on grains, legumes, which is your beans, and then we got a big nut section. This is right here already at least 20, and then vegetable is a big section. And this is great, especially for people who are vegans and vegetarian. There are vegetarian panels, which is great. So it's expanded, so it's all sources of food in the vegetarian panel. There's an Asian panel. So there are different panels that we can run specifically to each person.
Yeah, and I really love about this test too is like a lot of times we have patients that come to us and they're on, an anti-inflammatory protocol, or they're on an AIP, just an overall paleo, or they're trying to remove the inflammation in their body. But say, what if there was a dairy issue and they removed the dairy, but then they were replacing it with almond milk, but they didn't know that they had an underlying almond intolerance.
This happens.
And this happens a lot. Where there's certain nuts or certain other grains that are coming in that are causing inflammation that are, seemingly a benign food or even a healthy food. How many times a day do I hear, I just snack on almonds throughout the day? Well, what if almonds are an underlying cause of your inflammation? We wouldn't know without doing the testing.
So this brings up an interesting point, and it's from a question that someone had posed on yesterday's video. And if you have questions, go ahead and start posting it right now. That would be great. If we have time, we have a little more time today, we may be able to answer some of those. Please, in the comment section, start adding people that you want to benefit from this video. Post your questions now, would be great. One of the things we noticed was, one of the questions that someone asked me was, she said, I'm already on an AIP protocol, and I'm really, and I feel much better with it, which is great. That's the point of the AIP protocol, which is the autoimmune protocol, is that it removes all the foods that innately can be challenging to your autoimmune system. she's like, what do you bring to this? Or what is it that you do that's so different? And my whole point was she was saying, is there a way to reintroduce food? And how do I go about that? That's huge. So one thing is, for me, an advantage of doing a test like this is that it's not a broad brush stroke, whereas like if someone doesn't have a doctor like me that they're working with on what to do with food, they will do an autoimmune protocol and receive some benefits with that. But then it is very limiting and restrictive. It does work, but the question is, how do you bring back stuff in and how do you get good data from that? So I love in the beginning to go ahead, and some people come to me already on the AIP diet. Other people will just come and say, give me the roadmap, which is what this test is, which is why I love this test. Now, once you get, the cool thing is, one of the questions yesterday was about, she said, what about reintroduction? That's where it shines when you have a roadmap and you have a nutritionist and a doctor working with you through your autoimmune disease. This is guidance. This is navigators for your ship that you need that helps you get good data when you reintroduce. Because it doesn't necessarily mean once you remove the foods that those are the foods that you're going to remove for the rest of your life.
Exactly.
Yeah. And one of the comments the person made was, I didn't notice I had huge problems, I think, until I went on a vegetarian diet. I noticed that I had a lot more food reactions. Can you talk a little bit about that?
Right. So a lot of times when we go onto a specialty diet, we start getting a load of certain foods going on in the diet. And that over time is going to really bring out and make shine the intolerance that's there. So say it is broccoli, right? And somebody goes on a vegetarian diet and they love broccoli. Well, that's going to be a larger portion of their diet. So that additive effect is going to grow in them even more. And so that additive effect, like Maggie said, 3 hours to 3 days. Well, if you're eating something that you have an issue with on a Monday, on a Wednesday, on a Friday, that over time is going to cause a lot of issues.
And the interesting thing is, one of the things you pointed out was that sometimes on these specialty diets, they work beautifully, but other times what happens is you're actually adding a food that you don't eat as much of, and now it's a huge part of your diet.
It's a staple, or it's the backbone.
It can actually backfire and trigger a worse autoimmune attack. So I've seen patients who sometimes get worse, or they're just holding at like a steady level of bad.
Yeah.
Okay. Hi, Lauren. Hi, Emily. Hi, Lisa. Thank you. And wherever you're watching from, please say your location, demographics. That'd be great. So this brings us to some of these stories. I would love to have you go over a couple stories of people with food intolerance, recent patients that we've had, and let's talk about it to illustrate some of our points.
Yeah. So one of my favorites is a gentleman that we were working with that had ulcerative colitis and had been struggling with it for 14 years. 14 years. And when he came to us, he was doing a diet called the specific carbohydrate diet, which is very often, a common protocol approach for dealing with ulcerative colitis. And it removes the complex carbohydrates from the diet. And he had gotten himself to a place where he was calling it, my UC is managed. I'm managing it.
We should talk about what that means.
Right. And so when we got into, the conversational, the story with him, we start to realize what a nightmare his management was, right? So this is an MD. He is an extremely high stress, high performing doctor. He is responsible for going to many conferences and speaking for long hours of the day.
He's a recognized national speaker in his field.
Yeah.
So super functional and super intelligent, and has done a ton with his diet.
A ton of work to clean it up. So his normal, what managing was excruciating bowel movements 5 times a day. By the time he came to us. This is 14 years down the road of doing all of these specialty diets, cleaning everything up, and still he was coming to us because he was about to have part of his bowel removed. He had a surgery.
He had made the decision, yeah.
He had made the decision. He said, you guys are my last hope. I'm going to have part of my bowel removed. This is where I am, 14 years down the line.
And he would starve himself for the day before and during the entire day of his public speaking so he doesn't have to run to the bathroom over and over again. Or he would starve himself before a long day of surgery or something just to make sure he doesn't go to the bathroom over and over again. This is management. This is real life. This isn't an MD.
Yes. So we do the food intolerance testing. We wait 4 weeks. We get the results. It was garlic and almond. Garlic and almond. 2 seemingly benign foods that are often considered healthy foods that he was eating a lot of because he was on this diet that had removed the complex carbohydrates, right? So he wasn't doing flours, but what he was doing was a lot of almond flour. he was doing a nut-based flour. So he was getting these particulates of almonds in his gut throughout the day, every day. And then garlic, as a seasoning when he was cooking. Totally normal, right? So we removed these two foods. Now his UC is managed. Now he is able to have full days, full weeks, full months since we've removed these foods without flaring.
He's involved with hobbies. That are outdoors.
He's traveling.
Things don't revolve around going to the bathroom. He's actually gained about 10 to 15 pounds of healthy weight and muscle because he's working out now. He has the energy to be able to work out. And it was one of those things where every winter or every certain season, all hell would break loose every single year for the last 15 years.
Yeah.
And within a very short period of time, literally about 2-3 months, complete turnaround. Garlic and almonds. I know.
Yeah.
So that's a great story to illustrate where people can work really hard either on AIP or SCD diet, and a little bit of guidance with the test can make a big difference. And working with Frankie and myself with the functional nutritionist is like life-changing. And we do, the question is going to come up about how do you get food intolerance testing, and I'm going to tell you that it's going to be the experience of people taking autoimmune, doing the food intolerance testing are really varied. Some of these tests suck, and so for me, I'm very keen on exactly the type of test that we use, and so I will only use the test that we use in our office. And I highly have to require working with a functional nutritionist like Frankie to actually properly interpret it, because there's a lot of false positives and false negatives. And there's also signs that there could be infection in there that could be missed. So we do offer the test as a distance package, and it's on the website's myfoodintolerance.com, and that's the only way I would recommend for me and people I treat to doing the food test responsibly and getting great data out of it. You got to get if you spend money on a test that's bunk, or you spend money on someone who doesn't know how to interpret this, that's a waste of money, because you're not going to get the results. So for me, it's very important to do it right.
The implementation piece is key, because just as in that story that we just went through, you remove a huge source of the almond flour from this person's diet. It's a huge source of protein for this person too.
What are you going to replace the protein with?
What are you going to replace it with? What is the implementation? What makes this diet varied and diverse and healthy for this person is not only what we're taking away, but what we're putting back in, what we're making sure that we're replenishing the diet with.
I think that's
It's a huge part of this.
But that is the biggest problem with food intolerance. Like, a lot of people call and say, I just want the test. Right? But they don't understand that what it means is that we look at what to remove and interpret the test properly first by knowing what to remove. But the second thing is, what do you eat more of? What can you eat more of? And when you have a roadmap to know what you can eat more of, that's great, because what if what you're more of adding blindly is actually triggering you to get worse, which is cases we see all the time.
Exactly.
We do have another case here, which was a 12-year-old that we saw recently, and her family had recently moved up to Oregon, and she was diagnosed about a couple months ago with having ulcerative colitis. And their conventional MD, the gastroenterologist, said food doesn't matter. That one will not talk to them about food. And in fact, discouraged them, actively saying that testing is bunk and that why bother. Was very you got to get on this drug, this drug, this drug. Some of these are chemotherapy agents, guys. These are like shutting off your entire immune system, which can actually cause an increased risk of cancer. Known side effect of some of these drugs for ulcerative colitis is cancer, and we're giving it to a 12-year-old as a first-line treatment and saying diet doesn't matter. That pisses me off. And that is my mission. It's like, this should not be happening. So what we did was we did a food intolerance test, one of the first things we did on this child, and what did we find?
We found that eggs were an issue, and we found out why eggs were an issue. It's because they moved to Oregon, they bought a farm, they started raising their own chickens, and all of a sudden there were tons of eggs in the diet. Eggs, great source of fat, great source of protein for most people. For her, it was the problem. It was what spurred and started the cascade of effect with the autoimmune disease, with the ulcerative colitis.
And the problem with the way the test is done is that most of these tests, when you do it, will say egg white, egg yolk, and then the problem is that there could be false positive with eggs. So because vaccines are grown in eggs, so then what happens is a lot of people will get a false reaction to the eggs on the test. But there's actually a truth teller in there. I look at also duck egg. And so I can tell, and Frankie can tell as well, what's really the people that have a problem with egg and who are the false positives. Unfortunately, a lot of people have had this test done and been told that they were intolerant to eggs, and they weren't. And then they blew the whole result of this test off saying it's bunk. No, it's not bunk. It's the interpretation was bunk. So getting this interpreted properly is really key. And I am happy to report within 10 days of the 12-year-old removing egg from her diet, the symptoms are gone. The symptoms are gone. And this is someone this is someone that was recently diagnosed about 6-8 months ago. And within 2 weeks, and mind you, during this 2-week period of time, the GI doctor was telling them to go on the chemotherapy agents and telling them that diet was bunk. This child currently has no symptoms whatsoever, and we're 3 weeks out right now.
And I love that we use this test with children, right? So a 12-year-old finding out this information now, thinking about what a different story her life is going to unfold without the chronic illness, without the problems of the ulcerative colitis. It's like, this is life-changing. It's, with children being able to make these changes, have this information, craft their diet, craft their life around these things, this makes a huge impact. I know for myself, and I tell a lot of patients, for me, dairy is a really big issue. And when I did my food intolerance testing, I flash back. I think about my childhood. I think about all the sinus infections I had. I think about all the allergies that I've struggled with, the skin problems that I've had. And I'm like, gosh, if I would have only known this as a child, what a big difference this would have made in my life and my ability for my immune system to be vital and to be really healthily reactive. And and I think that that's something like, when I work with children and we implement these diets, it's tough. They need support. This is big stuff that we're doing. But at the same time, the reward is huge.
Well, if you look at this 12-year-old, this is like daily diarrhea with bleeding for the last 8 months of her life. And that really low iron has caused her to be so fatigued and tired, her ability to participate in school, social activities, so this is a huge thing that you can turn around within 2 weeks of a diet change. To me, night and day difference, symptoms stop like that. This is a no-brainer for me. So it's not just, and the thing is, we're talking about it in terms of autoimmune disease for this Facebook Live, but think about this in other conditions, such as people with what's called IBS, irritable bowel syndrome. Think about it in chronic sinus infections and allergies, behavioral issues in children. How many children actually have a problem because they are so irritated, their body is fighting these foods that, it's causing them to actually hyperreact, and then they're, in school acting out. We had a child recently where it was the Candida, actually. We should talk about Candida.
It's true because, like I said earlier, the Candida and the infection really plays in with the food intolerance. The food intolerance allows the Candida to grow and overgrow, and the infection can get worse for people. So I have another story about the Candida that we wanted to go through today as well. A gentleman that we work with that had... he had food intolerance testing done years ago, had kind of, done it for a while, then everything had slowly slipped back in. And then he comes to us, he's not able to drive, he's not able to work, and he's actually presenting as kind of intoxicated.
And that's how he describes his life. He said, I felt like I was drunk all the time. I'm in my job, which I can't function anymore for the last decade. I can't function in it, and it's even difficulty with driving, severe muscle aches, testosterone in the tank of like 150, something very low like that. So we actually redid the food intolerance test. We wanted to make sure that we weren't missing anything because it had been several years ago. So we redid the food intolerance testing, and we also found that there was a positive for the yeast overgrowth in his system. So we removed the food intolerance. We treat for the Candida, for the infection. We just saw him last week. He's our poster child.
He really
I wish there was 10 of them. I really do. Because
he's working. He's doing house projects. He's driving to come see us. The intoxication symptoms are completely gone. The IBS symptoms are completely gone. He's able to walk a straight line. You know, I mean,
it's working exactly
turnaround.
what he wants to do. His life, you know, what he loves to do in his job, he's doing it to the full extent he wants to do it now. Instead of the candida controlling him, the fatigue and the pain, he's actually determining what his schedule, what projects he takes on or not right now. Mm-hmm. And he looks so good. Like, people are noticing left and right. Whoa, what's going on with you? And this is by identifying that someone has a candida infection, which is something that we can do on the food intolerance test. There's actually a hidden clues that there's someone with that you have a candida infection in there. So I love it as a bonus.
Yeah. Mm-hmm. Mm-hmm. Yeah.
So a lot of these are stories about food intolerance, and you guys wanted to hear more about this. And so if you have additional questions on food intolerance, feel free to post it, and even afterwards we'll be looking on it, and I'll be happy to answer that. Go ahead and comment with anyone that you think could benefit from this information. We do offer a distance package with food intolerance testing on myfoodintolerance.com if you want to check that out. But the other way that you can do it is if you're local, coming in and working with us to get food intolerance testing done is really great. And if you're in your local area, you can find a physician, a functional medicine physician that specializes in autoimmune disease or food intolerance testing. You could Google that and look for that as well. But it is difficult to find because you really want somebody who really knows how to interpret and has done thousands and thousands of these tests, and someone like Frankie, who's a nutritionist, a functional nutritionist, to help implement that, because I can't do what I do without you.
Mm-hmm. It's a perfect team. It's a perfect match.
Mm-hmm. And it's crucial, and that's why I do structure the practice the way that I do, because insurance doesn't pay for a functional nutritionist to support you and be there for you at every visit. Well, I have structured my practice in a way where that has to happen, and that's the kind of care that I need to provide people, the testing and the support that people need to get the results and outcomes. So this is really, functional medicine is about how to function better, and I love to structure a practice, which is what I've done with making that happen for people every single day. And then we also offer that as a distance package for food intolerance testing specifically. Mm-hmm. So feel free to share this to your autoimmune disease group, any group for food intolerances. That'd be great. Comment below, like my page, and get notifications. Thank you, Niwot, for joining us.
Thank you, Maggie.
And thank you for all the people that are joining in. Megan, thank you. And so we're doing this for 30 days. So if you get notifications, we're on typically 10:45 Pacific Standard Time, Monday through Friday. And we'll be covering more topics in autoimmune disease for the rest of the week. Thank you. And thanks for the wow face, the hearts, and the likes. Yes. All right.
Bye, guys.
See you tomorrow.